Welcome to this presentation on the ViOptix tissue oximetry monitor, which is a part of a series of presentations and videos on free flap care for nursing and staff. In this presentation, we will provide a brief overview of the use of ViOptix tissue oximetry monitor for post-op monitoring of free flaps. In the previous videos, we have talked about ways that we assess the free flap artery and veins. But we have other technology that allows us to assess end organ function, or perfusion and oxygenation of the flap. ViOptix tissue oximetry monitor is a non-invasive method of free flap monitoring that uses near-infrared spectroscopy to assess overall flap perfusion. This technology provides continuous real-time monitoring, which can be monitored remotely by the surgeon. This is very sensitive technology, but may provide some of the earliest clues to impaired flap perfusion, ultimately allowing us a better chance at intervening to avoid free flap complications and loss. The ViOptix sensor probe affixes to the flap skin and emits near-infrared laser light that penetrates 10 to 20 millimeters deep. Some of this light is absorbed by hemoglobin and some is reflected back to the sensor probe. This reflected light is measured and used to infer percent oxygen saturation in the free flap. The sensor probe is attached to a fiber optic cable leading to a sensor head. This sensor head then attaches to the ViOptix monitor via a connector channel. The ViOptix monitor typically comes mounted to a wheeled stand for mobility. The sensor head attached to the sensor probe connects to one of two channels on the ViOptix monitor. The two channels can be used in cases of bilateral free flaps. These sensor heads are maintained connected at all times to provide continuous monitoring. The AC power cord connects firmly to the rear of the console. Be sure to keep the ViOptix monitor plugged into an outlet, as it has very limited battery life and cannot rely on batteries alone. The power switch should always be in the up position toward the 1. The ViOptix monitor provides information on the flap oxygenation and perfusion. The signal quality value tells us whether or not the sensor probe is getting a good signal from the flap, telling us the reliability of the signal. Our goal for signal quality is 80 or better. Things that can cause a poor signal quality are poor contact of the probe with the skin, fluid between the probe and the skin, and bright lights directly on the flap. The tissue oxygen saturation measures local oxygen content in the flap. This will provide a different value than the patient's pulse oximeter value. The tissue oxygen saturation is also displayed on a graph showing trends over time. It's important to remember this is not an absolute value goal for oxygen saturation, but rather a trend over time. Compression on the flap or formation of clots in the flap can compromise blood flow to the flap, so the ViOptix provides instant feedback on perfusion of the flap. There is considerable variation in tissue oxygenation between individuals, flaps, and different areas of the same flap. For percentage oxygenation, the relative trend in oximetry value over time is more important than an absolute value. Remember, the flap percentage oxygen saturation frequently differs from the patient's pulse oximetry value. Parameters and thresholds are set by the surgeon. These should not be changed by the staff. An alarm is triggered when these thresholds are met, including a precipitous drop of 20 percentage points oxygen saturation over 1 hour, and a drop below an absolute value of 30% tissue oxygen saturation. If these alarms are triggered, you should contact your surgeon. One of the strengths of the ViOptix is that this device is very sensitive, allowing us to detect changes in blood flow early. However, because of this sensitivity, direct or bright lighting on the sensor probe may cause errors or changes in the oximetry and signal quality. Again, with ViOptix, we are not looking for an absolute value or level for percent tissue oxygenation, but rather a relative change or trend over time. These trends can give us information about any underlying causes of changes in flap perfusion. One of the advantages of ViOptix is the ability to remotely monitor via smartphone or computer. If alarms are triggered, the surgeon is immediately notified via text message. Case example number 1. This patient with a free flap to the thigh and ViOptix tissue oximetry monitoring, we see a drop in the flap oxygen saturation as the patient was moved to a chair, where the chair was compressing the free flap, obstructing blood flow to the flap. The patient was then repositioned to their hospital bed so that no pressure was exerted on the flap, and we subsequently see a sustained improvement in flap oxygen saturation. Remember, compression on the flap or formation of clots in the flap vessels can compromise blood flow to the flap, so the ViOptix provides us instant feedback on flap perfusion. Case example number 2. In this case, we have both ViOptix monitoring records and clinical correlation. This patient with a free flap to the breast for sarcoma reconstruction had a precipitous drop in her flap tissue oxygen saturation, which also is seen to correlate with the clinical evaluation of a mottled, dusky, purple discoloration of the flap skin, indicating a problem with venous outflow to the flap. After being taken to the OR, this patient was found to have a thrombus in the free flap vein, obstructing venous outflow from the flap. For further information, there is an official ViOptix in-service video available online at the address below. Thank you for watching this presentation on the use of ViOptix tissue oximetry monitor. Please stay tuned and follow for more presentations and videos on free flap monitoring and care after surgery.